Hi, everyone. We're going to get started in a few minutes, but I wanted to do a quick sound check. So if you can hear me, will you please type into the question box and let me know? Thanks. Hi, everyone. Welcome to the Insure Our Kids, TennCare and Covered Kids Eligibility and Enrollment, the Basics training. This training is part of the Insure Our Kids campaign, which is a statewide campaign to enroll every eligible but uninsured child in Tennessee. The webinar will be about 45 minutes long with time for questions at the end. If we don't get to your question, we will answer it in an email afterwards. We'll also be sending slides and a recording of the presentation, so don't worry too much about writing everything down. And type your questions into the question box as you have them, and we'll check them at the end. So with that, I will turn it over to Kanika Young, who is the Director of Children's Health at the Tennessee Justice Center.
Thank you, Anna, and hi, everyone. Thanks for joining us. Today, we're going to just go over some basic information about who's eligible for these public insurance programs and what opportunities there are to connect people to enrollment assistance across the state so they can get help with applying for TennCare and Covered Kids. So first, we want to talk about the long-term effects of comprehensive coverage for kids. Studies show that children who have comprehensive coverage do better in school. They miss fewer days in school due to illness or injury, and they are more likely to finish high school, attend college, and even graduate from college, leading to a more productive work life as adults, and healthier adults visit the emergency room less frequently and have less hospitalizations. And so as a result, they earn more as adults. So insuring kids early in life is a very good way to invest in our future and make sure that adults have the physical capability to actually work and provide for their families so that they are not reliant on public insurance programs as adults. So this is really Medicaid and Cover Kids, or CHIP, are tools to effectively help families rise out of poverty for many generations to come. One thing that some people may be surprised to learn is that almost every child is eligible for something. We'll talk a little bit towards the end about barriers that exist for some children, but the default or the assumption should be that every child is eligible for these programs. So if you come across a child who is not insured, these may be options for them to get coverage. So the programs that we're talking about today are the public coverage categories known as Medicaid and CHIP. Each state operates its own Medicaid and CHIP program, and so in Tennessee, our Medicaid program is called TennCare, and our CHIP program is called Cover Kids. There's also a third category called TennCare Standard. This is sort of a hybrid between Medicaid and CHIP, so we'll talk about the unique features of TennCare Standard as well. TennCare, as I said, is Tennessee's Medicaid program. It is a federal-state partnership between the state and the federal government, with the federal government paying the majority of the costs for the program and Tennessee kicking in its portion of those costs. The state has to administer the program within certain guidelines that are set by the federal government, but there are some things that provide flexibility, so different states will choose different features of their Medicaid program, and so that's why they say if you've seen one state Medicaid program, you've seen one state Medicaid program, because they can vary quite a bit from state to state. In Tennessee, there are about 1.5 million people enrolled in TennCare. It covers half of all Tennessee children, covers half of all babies born in Tennessee, and it's a major source of funding for the state's network of neonatal intensive care units. It's also the single most important payer for services for children with severe health care needs. Not all children who have severe health care needs can take advantage of TennCare because of certain income limits that we'll talk about later on, and that is one of those significant barriers for some families who can afford insurance but also don't qualify for TennCare because they are above income. There is an option available that the state hasn't taken advantage of that we'll talk about, but for the most part, it is a lifeline. TennCare is a lifeline for families that have children with severe healthcare needs and for children who just need the basic healthcare coverage that everyone would rely on and benefit from. So some particular benefits of TennCare are what's called the EPSDT standard. EPSDT is a mouthful, but it stands for Early Periodic Screening, Diagnostic, and Treatment. What this standard says, and this is one of those federally mandated rules that I mentioned, that's a common feature of the federal-state partnership, but it requires that all children on Medicaid receive everything that they need that's medically necessary. So that would include periodic and interperiodic assessments of growth and development, immunizations, lead poisoning testing, comprehensive vision, dental and hearing services, and any other medically necessary diagnostic and treatment services. So this is a really strong feature of the TennCare program. So if a child qualifies for it, it is the preferred program for children in the state. So Cover Kids, as I mentioned earlier, is Tennessee's version of the CHIP program. CHIP is the Children's Health Insurance Program. It is also a federal program that was started in the 90s that has enjoyed bipartisan support. And it essentially provides a health insurance option for families who are a little above the income cutoff for TennCare, but the benefits are a little different. So in Cover Kids, as of fiscal year 2017, there were over 103,000 children enrolled in the program. That's actually slightly down from the previous years, which was at about 106,000 children. We're not quite sure why the numbers are going down, not only for Cover Kids, but we're also seeing a decrease in the numbers of children enrolled on the TennCare program as well, which is another reason why we are grateful for people who want to get this information and share it with their clients or neighbors or loved ones, so that people who are not enrolled in these programs can get enrolled and find out how to get assistance with that. Again, Cover Kids being a federal-state partnership, the federal government pays a large portion of the cost. In this instance, the federal government pays 99.07% of the cost associated with Tennessee's CHIP program. That includes Cover Kids and TennCare Standard. So as I mentioned before, TennCare Standard is sort of a hybrid. So when we look at the funding levels for this, that's counting Cover Kids and TennCare Standard. So the Cover Kids benefits differ from the TennCare benefits because the EPSDT standard does not apply. So each MCO or managed care organization, in this instance, Blue Cross Blue Shield of Tennessee is the MCO that runs the Cover Kids program. They would set a benefit package that lists out what's covered and what's not covered and what the copays or deductibles would be associated with those programs. So they're still very good benefits. They provide low-cost comprehensive health coverage through this managed care plan. It covers preventative health services, doctor visits, hospital visits, vaccinations, well-child visits, developmental screenings, and mental health. Children can also get vision and dental care as part of the Cover Kids benefit package. It's actually modeled after the plan that the state employees are offered, and we have heard that state employees are not eligible for Cover Kids because of the design of the program, that there's some exclusionary rules for state employees, but I think that is because the plan is similar to what state employees are offered through their employee benefit packages. But just to back up a little bit, so the managed care framework that I mentioned, this is sort of becoming more popular, but Tennessee was the first state to convert to a full managed care program for their Medicaid. And what that means is the state essentially farms out certain administrative responsibilities to a managed care organization like Blue Cross Blue Shield or AmeriGroup or United. Those insurance companies are responsible for the administration of the program, so they would be getting people enrolled and giving them access to the provider networks that they've created for their other insured population. So the state would provide a certain fee per person and pay that to the MCO, and the MCO would then take that money and use it to pay claims and to serve those administrative functions for the enrolled population. So that's what managed care means. In this instance, the managed care organization, like I said, is Blue Cross Blue Shield, but Cover Kids is open to any child who meets the income criteria, but also pregnant women. And we'll talk a little bit about how pregnant women and newborns can get enrolled in the Cover Kids program, as well as TennCare. Cover Kids does have a cost sharing element. There are no premiums for the program, but they do feature some deductible or copay, but it cannot exceed 5% of the family's income by law. Cost sharing varies based on the service and the income of the family, but there's no cost sharing for well baby and well child care, including immunization. So that's something good for families who rely on the program. So now we get to TennCare Standard. TennCare Standard is for children under the age of 19 that are on TennCare but become ineligible for whatever reason. Usually it's because the family's income has changed. So in that instance, if the child was eligible for TennCare and enrolled, they can enroll into TennCare Standard until they turn 19 years old. If they don't have access to a group health insurance plan, and by group we mean an employer-sponsored plan, something that would be offered to a group or pool of people, not an individual plan that's like what's sold on the Affordable Care Act marketplace. So having access to a group health insurance plan would be a barrier for the child to roll into this program. They also must be a U.S. citizen or U.S. national eligible non-citizen, and they have to be below 211% of the federal poverty level, which equates to about $52,000 for a family of four. If they are above that income level and they also have a qualifying medical condition that would prevent them from getting health insurance prior to the Affordable Care Act, then they can still get into TennCare Standard. And so qualifying health conditions are those very serious illnesses like cerebral palsy or congestive heart failure or even juvenile diabetes, any sort of chronic medical condition that previously insurance companies could use as an excuse to not sign a policy for someone, or they would charge them higher premiums for that. The Affordable Care Act changed that, but this is basically saying that there are certain conditions that historically would have kept someone from getting health insurance, so we want to allow this exception for people who are above income and have those conditions. So in Tennessee, there are 1.5 million children in the state, and this is a breakdown of how they are covered. The numbers for TennCare are actually reported on a monthly basis. This number has actually gone down, so the number is closer to 740,000 kids currently on TennCare. TennCare Standard, as I mentioned, and Cover Kids are use the same pot of money, so they kind of are reported together, but that's at 103,000. The marketplace covers about 21,000 children in the state of Tennessee, and about 686,000 children are on an employer-sponsored plan, likely their parents, listed as dependents on their parents' plan. And then we have the uninsured number. As it stands, there are 53,000 children in the state who are not insured, and of that number, 34,000 roughly are eligible for TennCare and Cover Kids. The uninsured but eligible kids is calculated based on income using census data. So it's not an exact measurement, but it does give us an idea of how many children are potentially out there who are not enrolled or taking advantage of these programs. And here we see by county the concentration of children who are uninsured. So the darker orange colors show the highest number of uninsured children in the county. And so number one on that list is Shelby County with over 11,000 uninsured children. Second is Davidson County with over 6,000, and then Knox County with over 3,000. So it's probably not that surprising because these are the highest populations in the state in terms of counties. But this is where we are, focusing our efforts to reach people who encounter uninsured children or pregnant women to get them the information they need about the program so that they can get enrolled and get coverage. So we mentioned earlier that there are some income limits for these programs. Some people may think that anyone who satisfies the income threshold can just enroll in Medicaid or public assistance programs, but that's actually not the case. First, you would have to fit within a category of eligibility, but looking at the income level, based on household size or family size, there's a cap for the program based on a percentage of the federal poverty level. So the percentages across the top of this bar graph are percentages of the federal poverty level, and then you see the dollar amount on a monthly basis and a yearly basis that corresponds to that percentage level. But here is where we wanted to sort of give you an overview of what categories of people can be eligible based on the different income limits. So looking at the gray bars on this graph, you see that the income cutoff varies depending on not only the household size, but the age of the child. So for 0 to 1 year olds, they can earn up to 195% of the federal poverty level, which equates for a family of 4 to about $47,970 a year. For cover kids, which is represented by these sort of light gray bars at the top of those first 3 columns, that's for families who are above the income limit for TennCare, but below 250% of the federal poverty level. And so we're talking about, for a family of 4, 250% of the federal poverty level is about $61,500. So not a really high number, but sort of median income level. So some families may not be aware that at that income level they can qualify for these programs. So we really want to spread the word about that and make sure families are taking advantage of the programs if they qualify. Looking at the 4th bar on this chart, it's noted as medically needy. This is a special category that is also commonly overlooked because this is for people who are above the income limit for TennCare and Cover Kids, but they have significant medical needs in their family. So if their expenses exceed a certain amount, they can subtract that from their income and come within the income limit for the program. And that's for any member of the household, not just the child or the person who's trying to get enrolled in the program. So that's a really important category that's often overlooked. I mentioned TennCare Standard, that is the last gray bar on the graph, and noting 211% of the federal poverty level is the cutoff, but it extends beyond that if they have a qualifying medical condition. The other categories that we wanted to note here are caretaker relative, which is the first bar that's in light blue on the graph. This is significant now because TennCare is in the process of seeking a waiver from the federal government to impose work requirements in their TennCare program. Work requirements in Tennessee essentially only impacts people who are caretaker relatives. Because Tennessee has not expanded Medicaid, you don't have any working age people on the program unless they are caretaker relatives, because there's an exception for disabled people, which is another category of age blind or disabled that qualify for TennCare. They will not be expected to work to keep their coverage. And of course, children would not be expected to work to keep their coverage. So this new proposal would essentially allow the state to deny Medicaid to families or parents who have children above the age of 5 if they are not satisfying the hours that are required. What many people don't know is that most of the families who are able, or adults who are able to work, do already work on this program. They just don't earn enough, or they don't have access to employer-sponsored insurance through their jobs. But another issue with the work requirements is that it creates red tape for these families, for all of them, even if they have an exemption because of a disability or if they satisfy that work requirement, they still may get caught up in the bureaucracy of the proposal or the new rules if they're approved, because they may not be able to keep up with the paperwork requirements, or the state may not be able to administer the program in an error-proof way because things fall through the crack, paperwork gets lost, and the state doesn't have a functioning computer system in order to monitor the eligibility of people enrolled in the program. So I wanted to point that out because the work requirements proposal has been submitted. The state is considering comments that were provided by the public during the public comment period, and then they will be submitting that proposal to the federal government for another round of comments. So we are monitoring that situation. We are trying to gather comments and submit them so that people can understand what the potential impact would be of imposing work requirements and the estimated losses of coverage as a result of people falling through the cracks in this situation. Another category that is not as commonly known is represented by the orange bar on the graph, and that's for former foster care children up to age 26. So this is for any child who's in the system, in the foster care system, when they aged out at the age of 18, they can stay on TennCare until they turn 26. It's a companion provision to a very popular part of the Affordable Care Act that allowed parents to keep their children on their plans until the age of 26. So this is giving that same protection to foster kids. There's very little, if any, publicity given to this provision or this category, so it's really dependent on people knowing that this exists and making sure that they are taking advantage of it if they can stay on TennCare. And this is regardless of their income. So you can see by the pointed arrow that they can have an income above the traditional cutoff for the program if they're a former foster care student or child. So now we'll talk through a couple of hypotheticals. I know this is kind of complicated and it's not really intuitive. TennCare has a lot of different pathways to coverage, and you have to factor in, different financial measures to determine eligibility. So the hypotheticals here are intended to sort of put this into context for people. So we have Eli and Amy here. Eli is the father, he's 28, and Amy is the 5-year-old daughter. They have a household size of 2, just the 2 of them, and they recently had an income bump. Eli got a promotion. So their monthly income went from $1,300 a month to $2,750 a month, and they have no resources. So Amy was on TennCare when their income was $1,300, but now that their income has increased, she's no longer eligible for TennCare based on their household size. So the question is, what options are available to Amy here? So Amy could roll into TennCare Standard. TennCare Standard, again, is for children under 19 who lose TennCare due to an increase in their parents' income, and they cannot have access to employer insurance. No matter how expensive that plan is, if she had access to any sort of employer-sponsored or group health insurance, then she wouldn't be eligible for TennCare Standard. But because they are still below 211% of the federal poverty level, she can roll into TennCare Standard. There is some issues concerning the redetermination process that TennCare is now in, and so this is coming up a lot more where people are being notified that they no longer qualify for TennCare. The redetermination process had been on pause for several years, but it was resumed in the fall of 2016 when TennCare started to send out huge packets to everyone enrolled in the program, asking them to return it with all of their information to determine if they're still eligible for the program. The packets are being processed manually because, again, Tennessee does not have a functioning Medicaid eligibility system. And so sometimes the packets are sent to the wrong addresses, or people receive them and don't know what they are. And there's not really a lot of assistance available for people to get help with understanding and deciphering what the packet is asking for. And so if they don't return it in a timely fashion, then they are disenrolled from the program. And so that's been happening a lot in the state, and people don't know that they are losing coverage until they go to the doctor or they go to the pharmacy and they're told, hey, you don't have health insurance. So this is something to be aware of. If you know families who are, receiving these packets, please encourage them to complete them in a timely manner and return them so that they don't lose coverage. But if they are determined to be above income and so they can't stay on TennCare, TennCare Standard is available, but they may not be automatically enrolled in the program. So to enroll in TennCare Standard, they would have to call the Tennessee Health Connection, and we'll show the number to that agency later on in the presentation. But this would be elevating that TennCare determination so that they can roll into TennCare Standard, because, again, it's not going to be an automatic thing in most cases. TennCare may not tell you that you're above income for TennCare, but you can get TennCare Standard. So that's something we have to be vigilant about. The next category that requires a little bit of vigilance on our part is the medically needy spend down. So under this provision, a family can subtract their medical expenses from their income, and if they're below the spend down limit, then they can qualify for medically needy spend down TennCare. So for this hypothetical, we are considering the Jetsons. Elroy is the child that we're trying to determine eligibility for. He's 10 years old. They have a combined family income of $4,500. Their family size is 4. Rosie the robot does not count at this point. So considering that family size and adding up their family bills that are listed here, they are below the limit for medically needy spend down. So subtracting their bills from $4,500 in income would bring them to $325. Well, actually, the medically needy spend down limit for a family of 4 is $325. So subtracting their bills, which add up to $4,450 from their income, which is $4,500, that shows a difference of $50, which is below the limit of $325 for this category. So Elroy would qualify for medically needy spend down. We won't go into detail about the resource counting, but there are resource limits for medically needy spend down. This is why it's relevant to note that they have $3,800 in the bank. The resource limit for a family of 4 is actually $3,200, but they can spend $600 from their bank account on something in the home or a car, and it would not count against them. So again, I know it's super technical, but the main takeaway here is that for families who may be above the income cutoff, consider medically needy spend down when determining if they can be enrolled in any of these programs. So another category that we want to highlight for TennCare eligibility is really relevant to people who are hospitalized for more than 30 days. So this is Catherine. She is 2 months old. She's been in the NICU since birth. Her parents have an income of $9,250, and they have $1,500 in the bank. So assume that Catherine is a part of a 3 person family household. So it's her and her two parents. So this amount, over $9,000, is well above the income limit for TennCare as well as Cover Kids. So she wouldn't qualify if if the family's income was a factor. But because she's been in the NICU since birth and she's 2 months old, Catherine can qualify for institutional TennCare. So institutional TennCare is for people who are institutionalized, meaning a hospital, a nursing facility, or something like that, for more than 30 days. At that point, for a person who's been institutionalized for more than 30 days, the parent's income no longer counts against them. So only Catherine's income would count once she's determined institutionalized. As a newborn, she doesn't have any income, so she qualifies for institutional TennCare. So to give you an idea of how this works in a real-life situation, here is Sheila and Jace Hobbs. They were clients of the Tennessee Justice Center. Jace was born prematurely. His biological mother struggled with drug addiction, and Jace spent the first 10 weeks of his life in the NICU. Sheila Hobbs and her husband, Dave, adopted Jace in 2016, but Jace had significant health needs, and they weren't able to take him home immediately when they adopted him. So he had been in Vanderbilt Children's Hospital for surgery to treat a seizure disorder, and he developed difficulty breathing and required a breathing tube. So after 2 months of treatment and care at Vanderbilt, he was ready to go home, but he couldn't be discharged because the Hobbs didn't have access to the home nursing care that Jace needed in order to stay safe and healthy. Unfortunately, the family had an ACA plan, but it did not cover home nursing. They are small business owners, so they purchase individual plans on the Affordable Care Act marketplace. And they could not pay for the nursing care that Jace needed out of their own pocket. So for almost 5 months, Ms. Hobbs searched, tirelessly for a solution for her son, and waited on hold for hours with different agencies trying to coordinate between the hospital staff and finding the support that Jace needed to come home. But Sheila didn't give up. And so through a social worker, she got in touch with the Tennessee Justice Center. And a few weeks later, Jace was approved for institutional TennCare. You may wonder, okay, so institutional TennCare is fine for while he's in the hospital, but what happens when he goes home? Well, in this instance, remember that you can roll into TennCare Standard. A child below 19 who was on TennCare can roll into TennCare Standard until they turn 19. So TennCare Standard is available for Jace once he gets home from the hospital, and he has a qualifying health condition and no access to a group health insurance plan, so he can remain on TennCare Standard until the age of 19, even though their family income may be above that 211% cutoff level. This is just an overview of the ages of children and different poverty levels for uninsured children in the state, just to give you an idea of how uninsured a child can be uninsured at various income levels. So we want to make sure that families are not just screening themselves and missing out on the coverage that could be available to them if they're not familiar with the income limits and how different things can count in their favor and be excluded from income to bring them within the income limits. In terms of ages, most of the uninsured children are between the ages of 6 and 17. So we want to make sure we're reaching those school-age children through outreach to teachers and other people in the school system to share the information with the families that come across their threshold and can benefit from having health insurance, which is very important for the reasons stated earlier for a child to be able to do well in school. So how do people get enrolled in these programs? As I mentioned, Tennessee doesn't have its own Medicaid eligibility system, but it also does not have its own application portal. Tennessee is the only state that uses healthcare.gov for its Medicaid and CHIP programs. So this screenshot shows, although open enrollment may be over, it's actually still open enrollment right now, but it's only from November 1st through December 15th. So that's open enrollment. But outside of that time frame, people can still enroll in Medicaid or CHIP by going to healthcare.gov. We know that this can be a barrier for some people if they don't have access to a computer or internet service, or they don't have high enough literacy to be able to complete this application on their own. But this is what Tennessee has to offer right now. They are working on a Medicaid eligibility system called TED that should be live, or should have been live about 5 years ago, but they're still working out kinks, and so the new rollout date has been pushed to, I believe, the spring of 2019. But until that system comes online, people have to go to healthcare.gov to apply for TennCare and Cover Kids. There are a couple of exceptions. Presumptive eligibility applies to newborns as well as some women with breast and cervical cancer. The Choices Long-Term Care Program is just a program that provides supports and services for people who have disabilities. And then the Medicare Savings Program is for older adults who qualify for Medicare and are dually eligible for Medicaid based on their income. But for our purposes, presumptive eligibility is the exception, and we'll talk a little bit about how that applies to newborns. For healthcare.gov, this is just a checklist of the information that people would have to gather to complete the application, and you can refer back to this once the slides are emailed out to everyone. But one thing to note is that if someone does not have verifiable income, meaning they don't receive a W-2 or a pay stub, they can submit a sworn statement to verify their earnings or to attest to the fact that they have no earnings if they're unemployed. That's a few more items. It's important, or it's a good idea, to gather this information ahead of time so that you can speed along the process of completing the application. And as I mentioned, there are some exceptions for people having to go through healthcare.gov to sign up. Here, we focus on newborns. There is something called TennCare deeming, Cover Kids deeming, and newborn presumptive eligibility. So for TennCare deeming, first up, this is for moms who are on TennCare. Their child is deemed to be eligible for TennCare for up to 1 year. The coverage starts on the date of birth, and the way they would enroll is to call the Tennessee Health Connection at the number listed to report the child's birth and have that coverage become effective. Cover Kids is similar. It's for moms on Cover Kids. The child is deemed eligible for up to 1 year. Coverage starts in this instance from the date the mother enrolled in Cover Kids. Because again, Cover Kids is not only for children under the age of 19, but also for pregnant women so that they can get the prenatal care that they need to have a healthy delivery. So it's important that moms get enrolled in the program as soon as they find out they're pregnant so they can get that prenatal care and have that coverage kick in for their child once they are enrolled. To enroll in Cover Kids or to enroll the newborn in Cover Kids, they would call the Cover Kids number to report the birth of the child. And so newborn presumptive eligibility is for newborns who are 12 months and younger, born to moms on private insurance or no insurance, and the coverage starts on the date of application. This is because you don't have to consider the mom's income or the parent's income to determine the newborn's eligibility. At that point, they are presumptively eligible, but you still have to submit an application. So parents would call the Tennessee Health Connection to enroll the child in presumptive eligibility, and they still have to do an application on healthcare.gov. So newborn presumptive eligibility is for families to have this coverage so that there's no lapse while they're waiting on the full application to be decided on. So children can remain eligible until there's a final determination on their full application, and then at that point, they can just have the regular TennCare coverage. But this is essentially to give coverage while the application is pending for that newborn. So a couple of best practices in speaking with people at the TennCare Bureau. These are some common things that they see that can hold up applications or prevent people from staying covered. One is failure to sign in all the places that are required on the documents. So just remember to sign when necessary. Make sure to answer all questions or write not applicable on the application. Also be sure to open any mail from TennCare. As I mentioned, the redetermination packets have been going out, and sometimes people don't know what they are and they disregard them, but that's really a mistake because it could impact their insurance coverage. Also need to timely respond to any inquiry from TennCare and make sure TennCare has the correct address. Again, if they send the packet to the wrong address and the person doesn't get it, they can still lose coverage, and there will be a process for them to reapply and get back enrolled in TennCare. So now we get to the point of the Insure Our Kids campaign. So we not only want to share this information with the public, we also want to help people get the enrollment assistance that they need. If you need help applying, you can call the 1-844 number listed on the screen. That is the Get Covered hotline that is staffed by the Tennessee Healthcare Campaign, and they can answer questions or help the person apply for the program, or refer them to Family and Children's Service. Family and Children's Service is a nonprofit organization. It's not a government organization, so it's distinct from the Department of Children's Services, even though the name sounds similar. Family and Children's Service is the organization in Tennessee that has funding from the federal government through the Navigator program to assist people on healthcare.gov. And again, because Tennessee does not have its own application portal, everyone has to go through healthcare.gov to apply for the TennCare and Cover Kids program. So that's where Family and Children's Service comes in to help those families complete those applications. For families that have already applied and been denied, they can call the Tennessee Justice Center at the number listed to get free help to file an appeal. Tennessee Justice Center helps people because they may have a complex situation related to medical needy spend down or institutional TennCare or some other obscure category that some people may not be familiar with. So the Tennessee Justice Center has that can get in the weeds and really explore all the different pathways to coverage that a person may have that may have been overlooked in the initial determination. So a few barriers that we are aware of. We want to raise these as we are working to overcome them. So the first one is income. I mentioned earlier that TennCare is a significant source of coverage for children with special health care needs, but income can be a barrier for some families that have children with those severe health care needs because Tennessee has not adopted what's called a Katie Beckett waiver. Katie Beckett was a young woman who developed a brain infection when she was very young, and her parents had insurance, but it had a $1 million lifetime cap. Her care was so intensive and so expensive that they exceeded that cap when Katie was very young. And her parents wrote to then President Ronald Reagan about their situation. And what's odd about it is that if they had chosen to leave Katie in the hospital where she could receive the care she needed, she would have qualified for Medicaid because, again, once you're institutionalized for more than 30 days, the parent's income no longer counts for the Medicaid determination. So they had to choose between either leaving her in the hospital so that she could receive the care she needed, or taking her home where they could not afford to provide that care, but they wanted their child to be home with them, as all families do. So they wrote to Ronald Reagan and spelled out their situation, and he created this waiver program. At this point, Tennessee is the only state that has not adopted some form of the Katie Beckett waiver. So right now, families who are above income but have children who have special health care needs are forced to sometimes work several jobs to pay their bills, or we've also heard of families divorcing so that their income for their household can fall under the income cutoff. And so it's really tearing families apart and putting added pressure on them. We are currently trying to gather stories from families that would benefit from this waiver if Tennessee were to adopt it, and to help them to elevate this issue to lawmakers so that we can get Tennessee to finally join the other 49 states and provide a solution for these families. Another barrier is immigration status. So federal law dictates that immigrants must wait 5 years before they can access any public assistance programs. But there's also an option for states to seek an exemption from this 5-year bar. Tennessee has not chosen to seek that exemption, so as it stands, immigrants, and we're talking about lawfully residing immigrants, not undocumented immigrants. Lawfully residing immigrants still must wait 5 years before they can enroll in the program, but there are some exceptions that we won't go into now, but generally that 5-year bar will apply, and they would have to wait to enroll in the program if they are also eligible based on income and their category. There's also another issue impacting the immigrant community right now, and that is the proposed change to the public charge rule. This is a rule that essentially talks about what form of assistance a person, an immigrant, would receive that would be considered for determining if they can apply for a green card or a different visa status, or even sponsor someone else to immigrate into the country under their household. So public charge historically has factored in cash assistance programs, so traditional payments that people would get to help them in that if they're low income. But now the current administration has proposed to add to the consideration for public charge things like Medicaid and CHIP and other programs that have historically not been included or considered for public charge, and even food stamps or SNAP. So we are still in the process of submitting comments on this proposed rule. If you're interested in finding out more about the public charge rule or speaking out about it, I encourage you to visit the Tennessee Justice Center's webpage, where you can find information to get involved in that issue. One other thing to note about barriers are that most people may not know that adoption assistance agreements can include TennCare as a provision under a certain provision called Title 4E in the federal law. This is for children with special health care needs who otherwise wouldn't be adopted. So this is to encourage families to adopt these kids by providing TennCare to care for their special health care needs. Here we have a list of all the organizations that have joined the Tennessee Justice Center in promoting the Insure Our Kids campaign to spread awareness about the programs and connect people to enrollment assistance. And we're very grateful for these organizations and for their help. One that I want to point out that isn't listed here that was recently added is the Common Table Health Alliance in Memphis. So we now have 22 partners that are on board for this campaign. I also want to encourage you to visit the Insure Our Kids website, where we have posted 2 very short educational videos about TennCare and Cover Kids, along with information about how to connect to enrollment assistance. So there's one for parents and one for providers. So that would be people who work with children or pregnant women, or come across those families that may be in need of the information. So please feel free to go to the website, check out the videos, and let us know if you have any questions. And that's all that I had to say. If there are no questions, then we can give you back the last 10 minutes.
Yeah, it looks like there aren't any questions. If you do have questions afterwards, please email me at awalton, WALTON, @tnjustice.org. And I can answer any questions that you have, and we'll also send out the slides in the recording. All right, thank you.